Hi, I'm Eric Roof, the Chief Executive Officer of Barber Community Health, and wanted to take a moment here to talk with Jennifer Berner, our PA, who's also Director of Quality Assurance and Risk and Safety Management, and our Clinical Director for our entire organization. I want to talk about telehealth today. I think that will help all of us kind of understand exactly what telehealth is and what it means to participate in a telehealth or a virtual visit. So, good morning, Jennifer. How are you?
I'm doing well today. How are you?
Doing great. Thank you for taking some time to chat with us today. Tell us about telehealth and kind of what services our patients can take advantage of while they're participating in a telehealth visit.
Sure. Through telehealth, we can do a lot. We can manage chronic disease. We can have patients review their glucose logs and their blood pressure readings with us, as well as manage medications and talk about side effects on those. We can also look at acute problems such as allergies or a cold or even a rash. About the only thing we can't do through telehealth is something where we need a medical tool to evaluate the patient. For instance, I can't check you for an ear infection because I can't look all the way into your ear through a video. But anything that we can do without that, we're able to do through a video visit.
That's great. Now, I know you're pretty connected to our behavioral health team, and you meet with them a lot too. So, if I happen to be a patient that is seeing one of the counselors at either clinic, how is that working the same way, or?
Absolutely. Actually, our behavioral health department has been doing telehealth for a while. They somewhat pioneered it for our organization, and it's a way to offer a nice, safe, secure visit. The patient can, participate in that conveniently from home, which, as we know, is particularly important right now.
Who can do these? Can anybody do them? Can adults, children?
Any patient who has access to the technology can participate in this type of visit. A child can participate in this type of visit, but we do want a parent or guardian with them during the visit, obviously. And also, if it's a child, a parent will have to give consent to participate in the telehealth visit.
So, using your computer, using your smartphone, you said all of those are.
Yeah, for a video chat where the patient and the provider communicate through video, patients will need to have a computer or a tablet with internet access or a smartphone which can connect them to the internet.
So tell me, is this secure? If I'm a patient out there, I might be a little concerned that, I don't know, somebody's going to get my information. You hear that about it being out on the internet and that people can steal your stuff. So is this safe to do?
Yeah, this question has come up from patients already, and it actually came up with providers when we started to implement telehealth. They wanted to make sure we were protecting their patients' privacy. We use a HIPAA compliant platform. It's called UpDoc, so it's very safe and secure. We don't record video, and we also have a lot of internal things that we put in place to protect the patient's privacy as well. The provider does the visit behind a closed door. We don't allow interruptions unless, of course, there's an emergency, and we don't allow anybody else to be in the room during the visit without the knowledge or consent of the patient.
Nice, nice. That's good to hear. I know that's been a concern for a lot of people that we've talked to so far. So if I'm a patient and I want to get started and say, hey, this sounds okay, I'll give it a try. What do I need to do to get connected to my provider?
If a patient wants to participate in a telehealth visit, all they have to do is call their provider's office and speak to registration like they would for any scheduling of an appointment. And if they'll just tell them that I want to participate in telehealth, our registration will walk them through the process and clarify that they have the technology and then get them scheduled for the appointment. When it's time for the appointment, actually they'll receive a link either through a text message or an email, whichever they prefer. And all they'll do is click on that link. It will take them right into the video visit where their provider will already be there.
I want to go back just a second just to make sure. So I can, as a patient, I can do the video chat, but can I do a phone call too? Just a phone call because I don't have the technology for the other?
Yeah, a virtual telephone chat is an option as well. We do try to encourage patients who have the technology to schedule a telehealth video visit when they can. Through a video chat, we can care for our patients remotely, yet we can still do that in a manner where we can see the patient. Even though it's through video, we're able to put eyes on them. And it allows us to get a better sense of what is going on with our patient and evaluate things that aren't as easy to do over the telephone only.
Very good. Very good. Well, thanks for clarifying all of that for us today. And hopefully this is helpful to the patients of Barber Community Health and the services that we want to continue to provide. I've had a couple of people in the community say, hey, is the clinic still open? Is Myers and Belington, are they still open? Yeah, we're still here. We're just doing things a little differently now. So we hope this was helpful today, and look forward to seeing you soon.